is Matthew Mayer. I'm a neurosurgeon in Richmond. I practice at Parham Doctors Hospital. One of the other things we do a lot of here at Parham Doctors Hospital is minimally invasive spine surgery. Really the advantage of smaller incisions, less blood loss, less scarring, and get people back to their jobs and back to their quality of life faster. Built on that is a lot of our minimally invasive technology where we're able to go in and take out a disc through a small incision, really a Band-Aid incision, and then take out a disc, a herniated disc in the neck or the back, and then get people as an outpatient and get them back to work and back to their family. From there, and using that same technology, we're able to complete bigger surgeries where we even do fusions and put in rods and screws for people that need bigger surgeries, but really don't need a bigger surgery done on their back, where we can do small incisions and quicker recovery times, and it really helps with the overall patient experience and what they can do before and after surgery. A list of things we do minimally invasive, we really start with the most minimally invasive, which would be a kyphoplasty, or putting cement into the bone for fractures. And then the next step up would be if somebody has a herniated disc, we can go in minimally invasively with a microscope and a small incision and then take out their disc. And that moves up to putting in rods and screws, which we can do minimally invasively through several small incisions to get it to work. And then even taking out larger bones and putting in cages and screws and rods for fusions. One of the things that really sets Parham Doctors Hospital apart is the whole community here. Where we have the technology in the operating room, we have minimally invasive spine surgery we can do. We have the O-arm, which is a intraoperative CAT scan, where we're actually able to take a CAT scan of the patient in the operating room and then use that, feed that into the computer, and use that to guide where we're going to do surgery and how we're going to put in screws or how we're going to do fusions. We're able to, once the patient goes to sleep, bring in a CAT scan and do a CAT scan of the patient while they're set up the way we're going to have them set up. And then we feed that information into the computer, and we use that to guide where we're going to put in screws, where we're going to put in rods when we do a fusion. And that helps us miss critical structures, the nerve, the spinal cord, and big vessels. That really makes it safer for the patient and makes that so we don't have to take people back and do more surgery. We're one of the few places in Central Virginia that has an O-arm in our operating room, and it's really come together to help with the spine program as a whole. And then from there, they have just an excellent post-operative care up with the nursing that we have and a dedicated spine floor where they get treatment by nurses that's all they do is spine surgery and take care of our patients. I think that whole picture is what sets Parham Doctors Hospital apart.